Hello, welcome and kumusta. Thank you for joining me. This is How. I'm your occupational therapist. And just to follow up on our previous episode where we talked about the myotomes and the muscles that are involved in different key areas or nerve roots, this time we will talk about the dermatomes. So this one goes side by side with the myotomes. So with dermatomes, there are key points as well. And what happens here is if you touch or the area of the body that you touch or you stimulate, it will correspond to the nerve roots onto the spinal cord. So let's get cracking. C4 will be the sensation that you will find over the acrom joint. So up in the shoulder, up on that level, that will be a C4. C5 will be the side of the lower edge of the deltoid muscle. This is also known as the regimental badge. Why is that? It's because if you put in a badge in there and you can look at some reference to military uniform, that's where you would find it, regimental badge, C5. So if you stimulate that part, that is C5. That is the key point for C5. 6 will be the palmar side of the thumb. Okay, so that will be the sensation on the thumb. C7 would be the palmar side of the middle finger. 8 will be the palmar side of the little finger. T1 would be the medial side of the antecubital fossa. So this would be the elbow. It is actually proximal to the medial epicondyle of the humerus. So if you turn your arm facing up, and it will be on the middle side of the elbow. So that would be the T1. That would be the key point of sensation in T1. T2 would be the apex of the axilla. T3 would be the intersection of the clavicular line and the third intercostal space. So that's very difficult to pinpoint, that T3. But it's much more easier to identify the T2, which would be in the apex of the axilla. And then the next thing would be T4, would be the nipple. Okay, that's the nipple level. So that would be the key point in there. And then the next thing from T5 to T9, those are the spaces between the nipple down to the umbilicus, because T10 would be the horizontal level of the umbilicus. So this would be the key point on the T10. And those are the key points, really. Everything else would be a little bit tricky on the thoracic region because they're very refined. But the key areas that you would have to find would be the T10, which would be the umbilicus, and then the T4 would be the nipple area. Okay, that should be that. And then now let's go to the dermatomes of the lower extremities or the legs. So we can start with L1, and L1 would be the inguinal region, and that would be the very top of the medial thigh, so down in the inguinal ligament. L2 would be the middle and the side and lateral aspect of the thigh. L3 would be the medial epicondyle of the femur, just inside the knee. 4 will be the medial malleolus. L5 would be the dorsum of the foot at the third metatarsus joint. It's the dorsum of the foot. S1 would be the side lateral aspect of the calcaneus. S2 would be the midpoint of the popliteal fossa, and S3 will be at the horizontal gluteal crease. And then the last one for us to remember would be S5 and S4, which would be the perianal area. So S4 and S5. Those are the things that you need to remember when it comes to the dermatomal region. So just remember these things, listen to these episodes every now and again, and then what you can do is every day just find out, try and touch a part, and then just remind yourself what they are. So for example, today the exercise would be I'd be touching the thumb, and that would be, you remember what that is? The thumb would be on the upper limb. That would be the palmar side. That would be C6. 7, that's easy to remember. That's the middle finger. Okay, so it's things like that. It's really important that you know why you say and why, if you want to ask, because say you're assessing a person and they're saying that there is some numbness somewhere. Normally, if there's no accident, then you would assume that it can either be central or peripheral nervous system. That's something that we'll talk about in the future. But you can just pinpoint the areas or the key point areas, like for example, the side of the deltoid muscles or the badger's area. Okay, so that would be the regimental badge. That would be the C5 level, or for example, the ring finger. You can identify these things. So it helps you start to identify where the problems are, so you can document that. And once you know where there is, then you can supply this information to the team if you are working with a team. And there you go, guys. It's very straightforward. And this is the dermatomes. I hope you enjoyed a little something today. Pass it on to your friends if you like it. Just remember, you need to grow as a therapist. This talk is a relevant information involving occupational therapy, which makes this talk a riot conversation. Thank you so much. Until next time, bye. If you enjoyed this podcast, talk to your friends and colleagues about it. Like it, subscribe, share, and do what you can to appease whatever algorithm that is at play. Just remember, guys, anything you do matters and has an outcome. Until next time, bye.